Epoprostenol, Flolan uses, mechanism and key facts. What is epoprostenol, Flolan? Epoprostenol, also known by the brand name Flolan, is a prostacyclin vasodilator used in the treatment of pulmonary arterial hypertension, PAH. This medication works by widening the blood vessels around the lungs, reducing pressure in the pulmonary arteries, and lowering the risk of blood clots. Epoprostenol, Flolan, is administered continuously through an intravenous, infusion using a portable pump. Although it is highly effective, the process of mixing and preparing the infusion can require careful handling, which some patients may find challenging. The most common side effects of epoprostenol, Flolan, include dizziness, headache, jaw pain, nausea, and flushing. These effects are usually mild but should be monitored closely under the supervision of a healthcare provider. What is epoprostenol, Flolan, used for? Epoprostenol, Flolan, is primarily used to treat pulmonary arterial hypertension, PAH, a serious condition where high blood pressure develops in the arteries that carry blood from the heart to the lungs. By lowering this pressure, epoprostenol, Flolan, helps improve symptoms such as shortness of breath, fatigue, and exercise intolerance, and enhances overall quality of life. How does epoprostenol, Flolan work? Epoprostenol, Flolan, works by mimicking the natural effects of prostacyclin, a substance the body produces to keep blood vessels open and prevent clot formation. Here's how it works. Vasodilation. It relaxes the smooth muscles in the arterial walls, allowing the blood vessels to widen. This improved blood flow reduces pulmonary pressure and decreases strain on the heart. Antiplatelet effect. It prevents platelets from clumping together, lowering the risk of clot formation within the pulmonary circulation. In patients with pulmonary arterial hypertension, blood flow through the lungs becomes restricted, forcing the heart to work harder to deliver oxygen-rich blood to the body. Over time, this can lead to heart failure. Epoprostenol, Flolan, addresses this issue by improving circulation within the lungs and restoring more efficient oxygen exchange. Side effects of epoprostenol, Flolan. What are the side effects of epoprostenol, Flolan? Like all prescription medications, epoprostenol, Flolan, can cause side effects. Many of these are mild and may improve as your body adjusts to the medication. However, some side effects can be serious and require medical attention. Always contact your healthcare provider if symptoms persist, worsen, or become concerning. Common side effects. These are among the most frequently reported reactions in patients receiving epoprostenol, Flolan. Bone, joint, or muscle pain, reported in 35% to 84% of patients. Dizziness, 59% to 83%. Headache, 46% to 83%. Jaw pain, 54% to 75%. Nausea or vomiting, 41% to 67%. Loss of appetite, 25% to 66%. Diarrhea, 37% to 50%. Fast heart rate, tachycardia 35% to 43%. Flushing 23% to 42%. These effects are generally manageable but should still be discussed with your healthcare provider, especially if they interfere with daily activities or do not subside. Other side effects. In addition to the more common symptoms, some patients may experience flu-like symptoms such as chills or fatigue, low blood pressure, hypotension, anxiety or nervousness, tingling sensations in the hands, arms, legs, or feet, skin reactions including rash or eczema, skin ulceration at or near the infusion site. These effects may vary depending on dosage, infusion technique, and individual tolerance. Serious side effects. Seek immediate medical attention if you experience any of the following serious adverse reactions while using epoprostenol, Flolan. Excess fluid in the lungs. Pulmonary edema signs include shortness of breath, persistent cough, chest pain, and fatigue. Bleeding problems, such as unusual or easy bruising, vomiting or coughing up blood, or the presence of blood in your urine or stool. Because epoprostenol, Flolan, can affect blood pressure and blood clotting, it's critical to remain under regular medical supervision during treatment. Your healthcare provider may adjust your dosage or monitor your response through lab tests and physical assessments. Typical dosing for Epoprostenol, Flolan. Epoprostenol, known by the brand name Flolan, is administered as a continuous intravenous 4. Infusion using a portable pump program to deliver the medication at a specific rate over time. Before beginning treatment, your healthcare provider will typically insert a central venous catheter, a small tube placed into a large vein near the heart. This allows for the safe and continuous delivery of the medication. Your care team will provide detailed training on how to prepare, handle, and operate the infusion pump at home to ensure proper dosing and minimize complications. The initial recommended dose of Epoprostenol, Flolan, is typically 2 nanograms per kilogram of body weight per minute, 2 ing/kg/min. Your healthcare provider will adjust this dose gradually, based on your clinical response and tolerance. Dose adjustments are made carefully, as both underdosing and overdosing can affect treatment safety and effectiveness. Because Epoprostenol, Flolan, is a short-acting medication, it requires continuous infusion without interruption. Even short pauses can cause a rapid return of pulmonary hypertension symptoms, so strict adherence to your dosing schedule is essential. Epoprostenol, Flolan. Contraindications. Contraindications are specific medical conditions or situations where using a medication could cause harm. Epoprostenol, Flolan, should not be used in certain cases due to potential safety risks. You should not take Epoprostenol, Flolan, if you have any of the following. Congestive heart failure, CHF. Epoprostenol, Flolan, may worsen fluid buildup and increase strain on the heart in people with CHF. Pulmonary edema, excess fluid in the lungs. If pulmonary edema develops after the first dose of Epoprostenol, Flolan, treatment must be stopped immediately. Continuing the medication in this situation can lead to severe breathing problems and other serious complications. Before starting therapy, your healthcare provider will perform a thorough evaluation to confirm that Epoprostenol, Flolan, is appropriate and safe for your specific condition. Ongoing monitoring during treatment ensures early detection of any adverse effects or complications. Pharmacist tips for Epoprostenol, Flolan. Essential pharmacist guidance. Epoprostenol, also known by the brand name Flolan, requires careful preparation and administration to ensure safety and effectiveness. Because this medication is delivered continuously through an intravenous 4. Infusion, proper training, handling, and monitoring are critical for successful treatment. 1. Always keep backup supplies ready. It's vital to have a backup infusion pump and extra supplies available at all times. If your infusion pump stops working or the flow of Epoprostenol, Flolan, is interrupted, serious and potentially life-threatening side effects may occur. Make sure your backup pump is functional and that you know how to switch to it immediately if needed. 2. Follow preparation and infusion instructions carefully. Your healthcare provider or pharmacist will teach you how to mix and prepare the medication and operate the infusion pump. If you're ever uncertain about a step, whether it's mixing the medication, setting the rate, or changing the infusion cassette, contact your healthcare provider before proceeding. Accuracy in preparation and infusion speed is crucial for both safety and treatment effectiveness. 3. Inspect the medication before use. Never use Epoprostenol, Flolan, if the mixed solution appears discolored, cloudy, or contains particles. The solution should be clear and colorless after preparation. If you notice anything unusual, do not infuse it. Contact your healthcare provider or pharmacist for guidance. 4. Maintain proper hygiene to prevent infection. Before handling your medication or infusion equipment, wash your hands thoroughly with soap and water. Dry with a clean towel. Clean the catheter site as directed. These steps significantly reduce the risk of infection, which is especially important when using a central venous catheter for continuous infusion. 5. Storage and stability. Unopened vials of Epoprostenol, Flolan, can be stored at room temperature in their original packaging to protect them from light. Once mixed, the medication can last for up to 8 days if stored in the refrigerator. After this time, discard any remaining solution, even if it looks unchanged. Using expired or improperly stored medication can reduce its effectiveness and increase the risk of complications. 6. Monitor common reactions and blood pressure. It's normal to experience mild side effects when starting Epoprostenol, Flolan, including low blood pressure, flushing, nausea or vomiting, dizziness, headache. Your healthcare provider will monitor your blood pressure regularly, especially during the first few days of therapy or when your dose is adjusted. Report any severe or persistent symptoms promptly. Administering Epoprostenol, Flolan, requires careful attention to detail, proper hygiene, and strict adherence to your healthcare provider's instructions. Maintaining backup supplies, monitoring your infusion, and following safe handling practices are essential for achieving the best results and minimizing risks. If you found this information helpful, don't forget to like this video, subscribe to HeInfo, and turn on notifications for more science-based explanations of medications and health conditions. Your trusted source for reliable medical information. HeInfo, where health meets understanding.